more results coming in. All right, thank you so much. So next, I would like to introduce our speakers. So first, I would like to introduce Dr. Dave Dubois. He is state climatologist from the New Mexico State University, and also Dr. Chelsea Langler from she's a program manager for New Mexico Department of Health Environmental Public Health Tracking Program. So you will be able to find their links on the chat. Welcome, both of you.
All right. Since I am listed first, this is Dave Dubois waving here. I will go ahead and share my screen. And once I get that up, I'll get a, let me know if you see my full screen.
We see your full screen. Thank you.
All right.
Perfect.
Okay, cool. Well, I don't want to delay anymore. We're going to talk about monitoring New Mexico heat trends. And so I'm showing a map here, and it shows numbers on each county, and which basically those numbers are the decadal trends and summer high temperatures. So those are from 1970 to last year, and those are June, July, August average high temperatures. And what those numbers mean here are the trends. So they're all positive, so they're increasing. So that those are the slope of the line going from 1970 to 2023. The high trends in degrees Fahrenheit per decade. So those are our decadal upward trends in high temperatures. As you can see, we vary from 0.5 to 0.9 across the state, even 1 over in Baca County. So that's kind of our setting, our environmental, where we are. And we're going to talk about some more details. And so one of the things I like to look at is looking at trends over time. And so this is the average number. This is the number of 100-degree days per year in Roswell. And so that I just picked this one because it was quite interesting, because we've seen some pretty high temperature trends across this location. Okay, there we go. So as you can see, going from 1950 to last year, we've seen the number of 100-degree days increase. We started off like in the 1990s, somewhere around 20 or so, 25. But ever since 2010, or even go earlier, you can see this upward trend over the last decade, 2 decades. And so last year, we had 67 days of 100-degree days or more, 100 plus degree days in 2023. Just looking at this year, this is basically what we call temperature anomaly, the number of degrees above average for the Southwest. As you can see, that everything is colored in this mustard to yellow, which is 1 to 3 is that light yellow, and 3 to 5 degrees Fahrenheit above average, and a few little spots are 5 to 7 degrees average. So most of the state, except for a couple little spots, everything is above average all the way across, going all the way into the Mojave across Arizona. And so if you look at the rankings for the New Mexico, this is the entire statewide average. This last month was the warmest in our record, going all the way back to 1895. So last month, and then going all the way back to 6 months. So each line is like the top one's June, the next one's May and June. That there's a 3 months, April through June, and you can go all the way down to the start of the calendar year. From January to June, it was the 8th warmest. So we've got a really warm start to 2024. And then this last month was the kicker, really warm. And I'm going to talk a little bit more about that, some cases here. But just looking at retrospect of last year, which was a record-setting year, I just put this map together of different locations across New Mexico. And then for each location, I counted the number of 100-degree days. So you can pick your area of interest and just look for that number. And that's the number of 100-degree days that we had for each location. And so like we said, Roswell had 67, 64 in Carlsbad. There's a 69 over at the waste isolation pilot plant east of Carlsbad, 52 in Las Cruces, and you can go down even all the way up in San Juan County, up in Aztec and Farmington. We've had 100-degree days in 2023. And so how did that compare with other years? So basically you put the same kind of data over on the right, that's last year. And then it was a similar year back in 2011. And this is basically the colors show the number of 100-degree days across the whole summer, basically. And you can see this very similar pattern. So kind of thinking through the weather conditions were very similar during these two years in terms of that high temperature. So that was a kind of an interesting comparison of between those 2 years. Just looking at this last year, June 14th was one particular day. There was actually several days of really interesting where we had some real extremes and some records broken. You can see I just picked a few of the locations across New Mexico. The map on the right is just the high temperatures contoured across the state of New Mexico. As you can see, there's areas that big areas that are over 100, and then even a few areas in that darkest red where we're over 105 and 105 plus. So you can see that area, you know, looking at your area where you live, kind of picking that kind of a pattern, seeing where, you know, Roswell and then the southwest part of the state, and even there's a little spot up in the Four Corners there that we're in the 100-degree. So far as of yesterday, this is kind of I just did a really quick query of the number of 100-degree days this year. You can kind of go through. This is ranked from the highest to lowest in terms of the number of degree days. Over down in Eddy County, Carlsbad, Brantley, those are the highest, and as well as Roswell, even all the way into the Upper Rio Grande, Albuquerque, Rio Rancho. We had 5 at the Albuquerque airport. So that's kind of, we're not following last year as much, but we did have a really warm, hot June. And I just want to remind folks of there's a really good kind of forecast product that's available on the National Weather Service, and that is the link. Basically, it shows the risk of heat related impacts, and this is produced every day, and it goes out and there's a forecast, and this is for tomorrow. So you can see, and there's different colors. There's 1, 2, and 3 in terms of the categories. Most of New Mexico is in the category 1, and then only in the Four Corners area, the northwest part of the state, we've got areas in the orange, which is the category 2, which is basically a moderate risk of heat-related impact. So this is an experimental product, but it's available every day, and it's actually over for the entire country. So you just go to that link, and then it basically shows you the heat risk that for the next few days. On the next few slides, I just want to real quickly go through the outlook. I know things change, but this is what it is right now. The next through the end of July and to the couple first days in August. The left side is the probability of warming above average temperature. So we're likely going to see this heat, even though we may get monsoonal moisture. It's like the right side of the map shows. That green shows the probabilities of above average precip, but that left map still continues to show probabilities of above average temperatures. And then going out to the rest of the summer, the same thing going on over on the left side, that the temperatures across New Mexico and across the Four Corners actually are probabilities are pretty high for above average temperatures going all the way out through September. And on the right side shows the precipitation outlook, which the forecasters, the Climate Prediction Center, they're showing a signal that maybe the monsoon may kind of dwindle off, be less impactful, and maybe start to dry out and heat up again toward the end of the summer. So it's kind of a heads up. We'll sit waiting to see what that that pops up again. These maps are updated on the third Thursday of every month coming up. So we'll see if that below average precipitation stays in the forecast. But the bottom line for this presentation is that that map on the left showing there's a good chance of above average. So that's kind of a heads up for those who track these things and need to kind of get the forecasts. So the last slide I want to show real quick is the weather network that we're working on getting temperatures at all these little triangles. And so this is going to be getting online really soon. We've got some of them already. We've got like 81 already online churning and getting temperatures every 5 minutes. Some of them are at schools, areas that are rural areas. And so keep a look on that URL, weather.nmsu.edu, for more information. And that's all I'll have, and I'll transfer it over to the next speaker. And there's my contact, and I'll also put it in the chat. So thanks. All right.
Thank you so much.
We move on to Chelsea.
Moving on.
All
to
right.
now.
Are you seeing my screen?
Yes.
Perfect. Let's see if we can do. Oh boy. All right. Look good. Okay, cool. Oh Jesus. So I'll be talking about the heat and health impacts in New Mexico. So thank you for the background, Dave. As part of the environmental public health tracking program, our main product is this public facing NM tracking portal that is publicly available. This is the homepage on the left, and on the right, we have the heat related illness content page that goes through, how to recognize it, how to treat it, how to protect yourself. We also have queries, which are, we'll go through what those look like farther down. But for anyone less familiar with what heat illness actually looks like and encompasses, so the first sign of heat illness is that you are thirsty. And then that can progress to heat exhaustion, which includes cramping, nausea, vomiting, rapid heart rate, sweaty, headache, dizzy, feel weak, generally not feeling good. If that is left untreated, it can progress to heat stroke and can progress very quickly to heat stroke, where you have a very high core body temperature of greater than 103 degrees. At that point, there is little to no sweating. Again, rapid heart rate, convulsions, confusion, fainting. It can progress to coma and death if left untreated. So some risk factors, environmental, the most obvious is if it is hot outside, if there's a heat wave. Less obvious are factors within the man-made environment, like limited access to transportation, limited access to medical care, the urban heat island effect. Some personal risk factors are age, if a person is under 5 or over 65, if someone is overweight, if they have existing medical conditions, socially isolated. There's also a very long list of pretty common medications that can impair the body's ability to regulate temperature or that inhibit perspiration. So this slide is to point out that, frequently we talk about extreme heat and the effects of extreme heat, but we actually start seeing the effects of heat at temperatures that, especially here in New Mexico, we would not consider anywhere close to extreme. So this graph is from the Albuquerque metro area last year. The red line on top is 90 degrees, the green line is 80 degrees. The orange kind of jaggedy line is the temperature for the metro region last summer. And then the purple line down below is heat-related ED visits. So you can see around, once it starts being consistently 80 degrees is when we start to see heat-related emergency department visits. And then once it's 90 degrees, we see there's a sharp increase in emergency department visits. And I'll also point out for the occupational standards, which Currently, there is no federal standard and it is proposed here in New Mexico, but consistently states that do have occupational heat standards, as well as what is proposed here, they all start at 80 degrees. And then the proposed standard here has the high heat provisions kick in at 90 degrees, which seems well justified based on what we see. So the next three graphs are going to go through first emergency department visits, then hospitalizations, then deaths from 2010 to 2022. And the graph on the left will show the visits from 2010 to 22. And then the map on the right is by health region, with red being the most impacted region and the lightest being the least impacted. I would encourage you to pay attention to the Northwest region. So for emergency department visits between 2010 and 22, we see that those have almost doubled in that time frame, with the Southeast and the Southwest regions experiencing the highest rate. And then if we look at hospitalizations, we see that those have increased about 65% in the same time frame, with the Southeast and the Northwest regions experiencing the highest rate. And now if we look at deaths, we see that deaths have quadrupled between 2010 and 22, with the Northwest region experiencing the highest rate, followed by the Southwest. I would like to point out too, all of this information is publicly available on the portal. And also on the portal, you can go through and look at it by specific counties, because obviously not every county in the state experiences heat the same way. So this example is Doña Ana County for the same time frame. Emergency department visits are on the left, with hospitalizations on the upper right, and then deaths are bottom right. So we see in Doña Ana County, heat stress emergency department visits increased almost 5-fold, whereas hospitalizations and deaths approximately doubled. I always think it's very important to think about the limitations and understand the limitations and think about what we might be missing. So for the emergency department data, as well as the hospitalization data, those are annual files that we get once a year with a pretty long delay. Like we'll get the 23 data here in the next coming months. The portal, we only include New Mexico residents. We do not get data from Indian Health Services or Veteran Affairs, and we do not get data from other states, so we don't include residents that seek care out of state. So if we look at Doña Ana County again, so this is the emergency medical services, the electronic patient care reporting, basically the 911 calls that are related to heat in Doña Ana County. So the calls that are in red, so anything south of La Mesa, basically, those, if they are transferred to an emergency department, those all go to El Paso, meaning that we don't get those, and our emergency department visits for Doña Ana County are undercounted. And then I included this on McKinley County just to show that each county is unique. So with McKinley County, they're not going out of state, but they are transferred more to the Gallup or the Indian Medical Center rather than Rehoboth, where we do get data from. So also in Gallup, we are undercounting our emergency department visits. And with thinking of, the trends in the Northwest region, at first I wondered if we see the highest death rate in the Northwest region because people weren't able to access care in time to prevent the most severe outcome. But looking at this, it seems like we're in fact underreporting emergency department visits. Now for the mortality data, that is also an annual file, and that also only includes New Mexico residents, which means we are missing all of the migrant deaths. So summer of 2023 set a 25-year record for migrant deaths in Border Patrol's El Paso sector, which the El Paso sector covers the westernmost tip of Texas, as well as all of New Mexico's border with Mexico. So from news reports, there were about 130 deaths along the entire sector, with about 100 of those happening at or near Sunland Park. which is right on, it's in New Mexico and it's right on the border with Mexico and Texas. This is a picture of Sunland Park with the border wall. And also from the news reports, it seems like a lot of these deaths are found by Border Patrol and or law enforcement, and then go through the Office of the Medical Investigator, or OMI. So now to address the fact that we only get an annual file. So last summer was the first time we really took advantage of the near real-time emergency department visits, which come in through a different data stream. And these do follow a different definition. It's a broader definition because it includes chief complaints as well as the final discharge diagnosis. So these numbers are not directly comparable to the annual file emergency department visits, but we do get them in near real time, and that is very helpful. So you can see here, this is from 2019, which is when basically in New Mexico, the first that we can reliably use this data source. So from 2019 to 2023, with this dark purple line being 2023. So you can see last summer we saw a huge spike in heat-related emergency department visits, with about half of those occurring in July. And then some findings from 2023 using these near real-time visits. So we looked at by race ethnicity. Unfortunately, the downside to having near real-time data is that it is messy. So there is a high percent of unknown here on the far right of this graph, meaning we can't really say much about disproportionately affected populations right now based on race ethnicity. But we can tell about 2/3 are male. Looking at the clinical notes, we see about 6% were outdoor workers, or about 13% with context. So we do get clinical notes and chief complaints, and that is very helpful, but it is far from complete. So about half are left blank. So about 13% with context were outdoor workers. About 10% with context were among the unhoused population. And then we also looked at mental health, because there is a complicated relationship between heat and mental health. So just under 3% of the near real-time visits were among people who have schizophrenia, schizoaffective disorder, or bipolar disorder, and almost 6% had a broader mental illness. Oops, there we go. Also very excited to say this has been released live as of end of May. So we have this new heat-related emergency department dashboard that is publicly available. It comes from the same data source that has the near real-time data. So the top one has statewide, you can see the maximum temperature in red, the minimum temperature in blue, and then the black line below is the heat-related visits per 10,000 ED visits. And you can, this is statewide, but you can filter by region. And then if you scroll through the tabs, you can see the year-over-year comparison. So now the dark purple line here is 2024, and you can see we've, in both May and June, we surpassed the rate that we saw in previous years, and are already coming up to where we, the second highest rate for July, which does not bode well, honestly. We also have urban heat maps. So this was developed in partnership with Florida State University and the University of Alabama at Huntsville through a program funded by NASA HACAST, which is the Health and Air Quality Applied Sciences team. So we have these urban heat maps for 26 cities around the state for both daytime and nighttime surface temperatures, with the red areas being hotter and the blue areas being cooler. And these are also publicly available on the portal following the QR code. And I can put links in the chat for any of this as well. So Dave mentioned the heat risk from the National Weather Service. So this past Earth Day, CDC launched its kind of version of heat risk that uses the National Weather Service heat risk, but you can look at it by county. And then you get, so this was for Lincoln County. This might have been, yeah, this was earlier this month. But for Lincoln County, and it has links to, you know, how to protect yourself from heat, also what the forecast is for that county, what it looks like for the country. And then it also includes air quality information, as well as, you know, how to protect yourself for air quality. So if you're interested in a specific county, I think CDC is quite a good tool, but it is, you have to pick a county. So if you're looking at a broader area, the National Weather Service one would probably serve you better. Also wanted to mention, so we have done a preliminary validation because the heat risk is based on mortality data. And so we've done a validation to see how it looks for emergency department visits. And preliminarily, there is a very nice dose response where we see, you know, visits start to come in when it's risk 1, more visits come in at risk 2, and the highest number come in at risk 3 and 4. So now various ways we communicate all of this. Our main product, again, is the tracking portal, where all of this is publicly available. We post things in the newsroom. We also issue press releases that will get picked up by various media channels. We have social media posts through the DOH accounts. Also provide media interviews, reports, respond to data requests, the new heat dashboard, which I'm very excited about. You can follow the QR code to sign up for HCNM Health e-News. They have environmental health option or anything else that you're interested in. And then just to summarize, so we do see an increase in heat stress around the state, and you know, we expect that will continue as temperatures continue to increase, with the southern and northwest regions experiencing the highest rate. We have applied for BRIC funding, which is building resilient infrastructure and communities, I believe. I know I am preaching to the choir, but hopefully if you get nothing else from this, you understand the strong need for a public health and climate program. Hopefully the third time will be the charm. In the meantime, we focus on communities most in need and most at risk. We assess and model potential health outcomes and climate events and continue communication. And there's my contact info. I think these will also be sent out. So I will stop sharing. I can figure out Zoom.
Thank you so much, Dave and Chelsea, for this beautifully done and terrifying information. This was awesome. Before we move on, we'd like to know, how much do you know about heat, health, and equity before we start? So you're going to get some questions there. So if you want to go ahead and answer those questions for us. Okay, answers are coming in nicely. It looks like most people have basic. I will share it in a moment. Starting to slow down a little. Go ahead and answer them. You still have time. Okay, just going to give you all 15 more seconds. See if there's anyone else who needs to answer those. Okay, I'm going to end the poll now. And here we have the results. So 50% basic, not bad. 23% minimal. Then we have 27%